Kia ora. My name is Ebson Abraham. I am a nurse practitioner employed at Onerahi Family Healthcare. As nurse practitioner, we are a part of 3 different teams. We are a part of medical team, we are a part of nursing team, we are a part of business team. So we kind of doing a collaborative work. Can you shrug your shoulders up there? Is it painful? In general, if you're seeing a nurse practitioner, you get the best of both worlds, from medical world and from the nursing world, and you are getting benefits of that on a long term with the follow-up.
Fantastic.
So balancing the role with a passion would be the first option, and at the same time here we are changing a role from registered nurse to a nurse practitioner. The transitioning role is something the patient has to travel with you and understand.
The value for the patients is being the nurse practitioner, he's able to provide that continuity of care. He's already got that relationship with them because they had a relationship with him as a nurse, and now they just see this as an extended process and they're really comfortable with him.
Our latest experience with our granddaughter has been excellent because she came from Brisbane in quite a crisis really. It was just lovely to see the time that he spent with her and made her feel he cared.
They're not just an upskilled nurse and they're not a mini doctor either. There's some areas that they can perhaps provide better support in than a doctor, one of them being particularly around mental health and addiction.
We've got many patients who struggle, mentally as well for various reasons, and having Ebson here is another great advantage because we can actually ask him to look after those patients, and it's definitely improved our care, and also patients just love seeing him. It's much easier to bring them here to see someone who they trust.
Onerahi, this is the first time they employed a nurse practitioner. They had the opportunities before, but they decided to have someone who grown out of from the nursing team. That was they were looking at. So they were passionate and patient in developing my role through the last 3-4 years.
She's getting tingling in the hands and fingers,
yeah.
And she is getting niggly chest pains. So more than likely anxiety. He's a wonderful role model for the junior nurses because he shows them that, hey, you're prepared to do the work, and he did work. He worked really hard to get to where we saw it. We sweated it along with him.
Even now, 6 months nearly down the track, I'm still getting some amazing feedback from our patients and actually from our team members here as well. I think they've been surprised by how successful this has actually been, and our nurses can come to Ebson now to gain some perspective and some knowledge on things that they're not so sure of, and they'd never thought about what benefit that would be for them. So yeah, it's just blown me away by how successful and the feedback that we've just had from the community as well as our team.
Some doctors are extremely hesitant and quite cautious about nurse practitioners, and I actually spoke to someone who thought that nurse practitioners take their jobs. That's not true. We are one team and it's enough work for all of us.
I have to say I've been extremely impressed with Ebson and the dedication that he's shown and how he's conducted himself in his journey, but not only that, how he now cares for our patients and the support that he provides to our doctors and to our nurses, and it's just amazing having him as part of our team.
I like that it's it's another pathway to make most of the skills of the nurse and the advanced nurse. I think it also helps to relieve some of the demand on our general practitioner shortfall at the moment.
Well, I can't imagine our life without him now.